Hello, this is Craig Christensen with H4 Technology here to present on the claims denial management system. We have partnered with ePS on working with their claims clients. We are a fully integrated software solution on claims management, as well as we have other analytical capabilities with behavioral health and EMRs. But we are working with ePS for claims denials, and we have a system set up with them to automatically receive daily files from their members, populate the dashboards and analytics, and then produce those out to you guys so that you can show them. So I'm sharing my screen. I'll go through a couple PowerPoint slides and then launch into a demo. So we are H4 Technology. We've been around for 8 years doing data management. We have partners with ePS, clearinghouses. We have Nebraska Hospital Association, centralized claims data management system. We are doing centralized data for Nebraska Department of Behavioral Health, Colorado, as well as now we have this scalable software as a service platform to launch claims denial management for clinics, for large providers, for any size group. It's a per person user fee, so it just depends on how many users you want, but there's tremendous value in this platform. Manage denials, look at payers, look at denial reason codes, as well as I'll show you the new reconciliation service. So real quickly, we'll get into this. Why claims data management? Average denial rate in the U.S. In the Midwest was 10%. We're seeing higher percentage in the Medicaid-funded populations. Our average denial claim was around $1,100, and denied claims take 16 days longer to pay. All of these denied claims, of all these, 63% are recoverable. Others, just are part of the process and problem. When we're looking at claims data management, we like to be the single source of truth. We have direct integration with your clearinghouse, so you can see the 837 claims that are being submitted daily, the 835 claims. We have filters by payer, provider, CPT code, time frame, CARC and RARC codes. And then we built all the reference tables so you know what a claim adjustment reason code is. And so that, you know what a 16 is missing, invalid, incomplete information. And so that allows you to go into your processes and find out what is going on. A lot of times when we're talking with people, they especially maybe on the finance side, they don't fully understand what the denial reason codes are. I know on the rev cycle side, you guys work with it daily. Really we're helping educate a lot of people on why claims are being denied and what the percentages are and if those are going up and down over time. So the last service we'll talk about is the claim reconciliation. This is submitted claims versus received claims, and really showcases what you can do when you have both 837 and 835 data sets. Part of those, there's tabs on there for full denials, partial, and then incomplete adjudication. So then you're not chasing down what has been sent out, but I haven't gotten paid on. This is an easy way to help you guys out with finding that information out. So when we look at our claims, we're seeing 19% of our claims denial reasons and the delays in cash flow are due to claim lacking service, lacking information. 9% are plan procedures not followed, and then we have a gamut of others. But ones that you guys can control are timely filing limits, to some degree prior authorizations, and then coordination of benefits. And so those are all things that you can do, work on, identify, and work with your crew to manage and reapply, so resubmit. When we're looking at the by payer graphs or CARCs, there's a variety of CARC codes out there. And generally what we see is people using these to identify the issue, identify the reason, the CARC denial and then look at their process. And maybe that's a procedure, maybe it's a certain paper trail, and go look at that and investigate and see what they can find out. All this helps, since we're getting the daily files, helps you optimize and helps you monitor the payer performance over time. So you can do this today, you can do this for last week, last quarter, last year, and then going forward, you can monitor these type of metrics. When I'm looking at the denial risk, the RARCs, these are common ones. There's missing, incomplete information, alerts, not covered service, procedures, billing errors, all that. So generally what we're finding is people, once again, highlight the CARC and then look at the RARCs to see what that makes up. I'll show you the graphs in the chart or in the system. So when we're looking at the new services, the reconciliation that we just launched, we have the ability to match the 835 to the 837 to determine if all claim lines filed with payer have been processed. So this is a newer service and it has tremendous power. So you guys aren't tracking down all the outstanding claim lines. There's dollar amounts that still need to be processed. Once again, you have all your filters for payer, provider, date ranges, and those type of things. When I'm looking at the denial analytics, we have a variety of buckets or use cases that are pre-built into the system. So we're referencing the Washington Publishing Company's file, and we built those use cases. So up top, you can see we have the denials overview. We jump into missing, invalid, incomplete, missing, invalid, incomplete data from submitted, billed services not covered by health plan, benefit for billed service not separately payable. And then when we were building this tool, we found out some payers don't follow these rules, so we created an outliers tab, as well as the, if you wanted to monitor your approved claims. So these help you dive into those use cases by CARC, by RARC, by provider, by payer, and analyze what's going on and find ways or best practices and ways you can improve it. So when we're looking at use cases, we had a group, a large group, had over $64 million in denial reasons, and this was a large group out east. We have these dollar amounts follow the percentages that we showed on the first couple of slides. So we had duplicate claims, we had prior authorization problems, we had timely filing limits, and they used our tool to identify gaps in processes and work on implementation and training and workflow issues internally to remedy these issues. Additionally, they didn't have the tools in place to arm themselves when they came up to payer contract negotiations. And so we are providing the data and the tool that they can go back to the payer on denials and on approved claims and dollars and help them renegotiate when they renegotiate, but we arm them with data when they go back. Additionally, we have a self-service tool that has the ability to look at all the data that's submitted through the platform. So we have 835 data, we have 837 data, we have a variety of visualizations, so you can pick out your data fields, you can filter on that data, select a visualization, build your own dashboard, and then share and save the work with others. This is really powerful and helps people answer questions, go get data sets, go drill down into a specific problem, and then have the data and arm them when they go back either to their own team or to the payers to remedy the issues. I'm going to jump into a quick demo, show you kind of the tool. Real quickly, you got eProvider Solutions in the upper left-hand corner. We have 3 tabs up top: 835 Claims Analytics, 837, 835, 837 Reconciliation. So at the top, I got a Denials Overview tab, and I have my filter. So through the filters, I can easily find a CARC, RARC, payer, provider, procedure. I simply click on that and apply filters. On the overview, the first, on all these tabs are the same, but just with different data subsets. So the denials overview, I got my denials by week for that quarter. I got a total claim line amount total and the number of claim lines. Below that, I can find out my payer mix. So I can hover over and see, okay, I got 34% is Department of Social Services. I got $24,000, 42 claims, 71 claim lines. On the right, I can find my procedures. So are they office visits? Are they, you know, a variety of injections or eye exams, or it doesn't matter what it is. A lot of times we have just simple office procedures that are being denied by payers. And so you guys have the ability now to filter on this and look at the data. Below that, we have CARCs and RARC codes. So these are why things are getting denied. So generally, like I said, we look at the CARC and then go to the RARC. So we have a patient has not met eligibility requirements. We have claim service lacks information. You can see the 16 and then the full CARC description there. We also have, this was other documentation was not received or incomplete or deficient, and expenses incurred during lapse in coverage, you know, all these things, right? So you have the ability to look at the denial reasons, filter on those by payer, and find out what's going on. All this data is built into the self-service tool. We have the export Excel icon, so you can always export the data you're looking at. And then down below here is the CARCs. So generally what we'd find, let's go look at maybe TRICARE. I'll look at those guys. So I got a whole bunch of data in here, but let's go look at TRICARE. Let's apply that filter. So I update my charts. And then I look at, okay, for the current quarter, we didn't have any data for the quarter, but we do have data outstanding. And then here's the eligibility. So most of my TRICARE denials are eligibility. And then these are the surgeries. I clear my filters and go to another payer. So generally we see people filtering by payer, filtering by or by provider. So. On the 837 side, I got another tab opened up here, 837. This is going to show you the billed charge amounts. So I have billed charges by billed charges for the time period listed. So these are going to be by payer, by procedure again, claim line, item totals, and numbers. So I have a variety of filters here, and I can just monitor what I've been charging. We also have claims referring provider. On the 837, 835 reconciliation, this is where I'm going to look at my incomplete adjudication, my full denials. Incomplete adjudication are those that haven't been denied, but the total charge on the outgoing 837 doesn't match the 835 plus an adjustment. Right? So there's still some outstanding information there that hasn't been. So on the 837, 835 incomplete adjudication, once again, I see my totals by week, what's outstanding. I see the total claim difference amount, the number of claim lines, and then I see some payer information, payer mix, so and procedures. So here I can see we got a huge group of emergency department visits that 36,000 is a big chunk of that pie. 3 of those claims, I could go in and filter on those specific claims to see the patient. Down below we have patient, we have the CARC and RARC if they're denied, and then down below this we have top 20 patient list. So I can easily filter on my payer, filter on a procedure, either one of those, and then just I have my exportable patient list, top 20 by patient ID by dollar volume that I can use. And so it's an easy way to sort that list and see what are the big ticket items or big dollar items that I should target first. So generally that's what we see people using the tool for. And once again, this is automated and provides that balance and reconciliation between what was billed out and what you received. We'll do the overview for the ePS denial management. I wanted to talk a little bit about the current promotion we have with ePS. And so this entire data management and analytics platform for your claims is only $250 per user per month. That is a phenomenal value for what you're getting. Since we have the integration with ePS already established, and we're doing this with current clients, we're waiving that fee in the implementation. So you get daily files integrated to the platform, balanced back to the for the reconciliation. All this data is at your fingertips now, and it's just a per user per month fee. We have complete business intelligence suite. We have interactive dashboards on the denial management, or the use cases, missing, invalid, incomplete, outliers, all that. And then I'll go into a whole nother segment on the self-service reporting. So all that data is available to you so that you can build and create your own reports, as well as investigate when you have questions or common issues. We produce documentation, do one-on-one training with you, bring you on board, have support, and then provide a best practices document as well. On the self-service side, I like to do that probably 2 to 4 weeks after you're live and you use the common dashboards. It's a little more involved, but there's documentation on that service as well. That's free and included in this platform. So I'd like to get, if you're interested in this platform, please reach out to us once again, or anyone at ePS. Once again, this is Craig with H4 Technology. We're proud to partner with ePS, and I appreciate the time and the ability to talk to you guys and show you what we're doing in the claims analytics world. Thank you, and have a great day.